I didn't like the lack of volume in my breasts. And as far as the tummy tuck goes, I had had 3 C-sections. And so I had a lot of scar tissue, not a lot of abdominal weight, but I had a lot of extra skin from the stomach stretching out, from the skin stretching out from the children. So, well, professionally, he is definitely on top of his trade. He knows exactly what he's talking about. I had, done a little bit more research on the internet about the processes that I was going to go through, and everything that I read matched up to everything that he explained to me by textbook. And personality-wise, as a personal person, he is the best. He's the best. He has the best bedside manner, very friendly, very outgoing, very interested in each patient's personal lives and how the surgery is going to affect each person. Very willing to take any phone calls at any time. Very, very nice guy. One of the biggest things, I've had a lot of doctor's appointments in my lives, and one of the biggest things that keeps you going to the same doctor is their office staff. And Dr. Mosharrafa's staff is they're perfect. They are the epitome of perfection. Very, very friendly, very courteous, always on top of things. They always know the right answers. And if they don't know the right answers, they get right on it and call you right back. Very friendly people. Very nice. It was very, very nerve-wracking, knowing that when you go in there, that this is the last time you're going to wake up looking the way you are. So you're very anxious, but at the same time you're very nervous. And once again, Dr. Mosharrafa stepped right up to the plate and reassures you that everything's going to be fine and he's going to do a good job, and make sure that what you're about to go through, the process that you're about to go through, is exactly what you want. I remember I was concerned about the size that he wanted to make my breasts, because I had very large breasts before I had children. And in order for me to not have to have a lift, he was going to have to fill me up, so to speak, quite a bit. So I was concerned about that, and he said, well, if you're concerned about it, then let's just not do it. Unless you're 100% comfortable with what we're about to go through, he said, I don't want to do it. I want to make sure that you're well aware of what the outcome is going to be. So very reassuring. I had an IV hooked up where you push the button every 10 minutes, and that kind of keeps you on top of things, keeps you on top of the pain. And then when I went home, I think I was sent home with Percocet or Demerol or something. And as long as you stay on top of the pain and don't let it, keep on top of the painkillers and don't let the pain get too high, the levels get too high, it's really not that bad. I was probably on painkillers, I would say maybe a week at the most. You pretty high levels to start off with, and then as each day went by, you kind of taper them down, and then you get to the point where you only take them at night to help you sleep. And I think I had probably day 3, I think he removed the breast and the stomach bandages. These steri strips stay on until they fall off on their own. And then I wore like some sort of a girdle, a Velcro girdle, for about a week as well. So probably about 3 or 4 days before the bandages were removed. I think I went 30 days. Dr. Mosharrafa had me go for 30 days without wearing a bra at all. So that was an adjustment. And it was probably about 2 or 3 weeks where they finally started dropping into position where I felt comfortable that the way that they were going to end up looking was what I was hoping for.